Did you know there's a common medical test that doctors routinely recommend after 70, but recent research suggests it might actually do more harm than good? I'm not talking about some experimental procedure. This is a test millions of seniors undergo every year, believing it will protect their health. I'm Maggie Wells, and today we're discussing something most doctors won't tell you: why certain medical tests after 70 may not be the best choice for your health, and what you should consider instead. Before we dive in, my important disclaimer. I'm not a medical doctor, and this video is for educational purposes only. Never stop or avoid medical care based solely on this video. Always have open conversations with your healthcare provider about the risks and benefits of any test or procedure. What I'm sharing today is based on current medical research and guidelines, but your individual situation may differ. Now, let's talk about the test that's been called into question by leading medical organizations. The test I'm referring to is routine colonoscopy screening after age 75 to 80, particularly for people with no family history of colon cancer and no concerning symptoms. Here's why this matters. For decades, colonoscopies have been considered the gold standard for colon cancer screening. And for many people, especially those at higher risk, they absolutely are valuable. But recent guidelines from the U.S. Preventive Services Task Force, the American College of Physicians, and other major medical organizations now recommend against routine screening colonoscopies for most people over 75. Why the change? It comes down to a careful analysis of risks versus benefits. Let's start with the risks. A colonoscopy is an invasive procedure that requires sedation, bowel preparation that can cause dehydration and electrolyte imbalances, and carries risks of complications including perforation, bleeding, and adverse reactions to anesthesia. These risks increase significantly with age. A study published in JAMA Internal Medicine found that adults over 75 undergoing colonoscopy had 3 times the risk of serious complications compared to younger adults. Another study in the Annals of Internal Medicine showed that the risk of perforation, one of the most serious complications, was 5 times higher in patients over 80. Now let's talk about the benefits, or rather, the diminishing benefits. Colon cancer typically develops very slowly, often taking 10 to 15 years to progress from a polyp to invasive cancer. If you're 75 or older with no history of polyps and previous negative screenings, the likelihood that a new cancer will develop and become life-threatening within your remaining lifespan decreases significantly. Research published in the New England Journal of Medicine found that for adults over 75 with no prior history of polyps, the number needed to screen to prevent one colon cancer death was over 1,000. That means more than 1,000 people would need to undergo the procedure and its risks to potentially save one life. Here's what makes this even more important. The bowel preparation alone can be dangerous for older adults. The strong laxatives used can cause severe dehydration, dangerous drops in blood pressure, electrolyte imbalances that affect heart rhythm, and increased risk of falls. For seniors with kidney disease, heart conditions, or who take multiple medications, these risks are compounded. And here's something many doctors don't discuss. The sedation required for colonoscopy carries its own risks, especially for older adults. Studies show increased risk of cognitive decline following sedation in seniors, temporary confusion or delirium that can last days or weeks, increased fall risk in the days following the procedure, and potential interactions with other medications. Before we continue, if you're finding this information valuable, please hit that like button. It helps more seniors discover important health information like this. And if you haven't subscribed yet, click subscribe and turn on notifications. We share evidence-based health guidance every Tuesday and Friday at 2 p.m. Now, I want to be very clear. I'm not saying colonoscopies are bad or that no one over 70 should have them. What I'm saying is that the decision should be highly individualized, based on your specific risk factors, overall health, and life expectancy. Here's who should still consider colonoscopy screening after 70. If you have a personal history of colon polyps or colon cancer, a strong family history of colon cancer, inflammatory bowel disease like Crohn's or ulcerative colitis, genetic syndromes that increase colon cancer risk, or if you're experiencing concerning symptoms like unexplained rectal bleeding, persistent changes in bowel habits, unexplained weight loss, or abdominal pain that won't resolve. In these situations, colonoscopy may still be the right choice, and the benefits clearly outweigh the risks. But here's what many seniors don't realize. There are less invasive alternatives for colon cancer screening that may be more appropriate after 70. Alternative number 1, FIT test, or fecal immunochemical test. This is a simple at-home test that detects hidden blood in stool, requires no bowel prep, no sedation, no dietary restrictions, and can be done annually in the comfort of your home. While it's not as comprehensive as colonoscopy, research shows it's highly effective at detecting cancers and advanced polyps with far fewer risks. Alternative number 2, stool DNA test, such as Cologuard. This combines FIT testing with DNA analysis, detects more abnormalities than FIT alone, and is recommended every 3 years. Again, no bowel prep, no sedation, and can be done at home. Alternative number 3, CT colonography, also called virtual colonoscopy. This uses CT scanning to visualize the colon, requires minimal bowel prep compared to traditional colonoscopy, no sedation needed, and carries far fewer risks. It's recommended every 5 years and can be a good middle ground option. The key point is this. After age 75, especially if you've had previous negative screenings, these less invasive options may provide adequate protection with dramatically fewer risks. So what should you do? Have an honest conversation with your doctor. Here are the questions you should ask. Given my age and health status, what are my actual risks of developing colon cancer? Considering my other health conditions and life expectancy, what are the realistic benefits of colonoscopy? What are my specific risks for complications from the procedure and bowel prep? Would a less invasive screening option like FIT or Cologuard be appropriate for me? If I choose not to have a colonoscopy, what symptoms should I watch for? A good doctor will respect these questions and help you make an informed decision based on your individual situation, not just a one-size-fits-all protocol. Here's another test that's being reconsidered for routine use in older adults: PSA screening for prostate cancer in men over 70. The U.S. Preventive Services Task Force now recommends against routine PSA screening for men over 70, especially those with limited life expectancy. Why? Similar reasoning. Prostate cancer typically grows very slowly. Most men diagnosed with prostate cancer will die with it, not from it, and the treatments for prostate cancer, including surgery and radiation, carry significant risks of incontinence, sexual dysfunction, and other complications that can dramatically impact quality of life. Studies have shown that for men over 70 with no symptoms, routine PSA screening leads to more harm than benefit through overdiagnosis and overtreatment of cancers that would never have caused problems. Now, this doesn't mean men over 70 should never check PSA levels. If you have concerning symptoms like difficulty urinating, blood in urine, or bone pain, PSA testing combined with other diagnostics may be appropriate. The key is symptoms-driven testing, not routine screening. Let me share what the real focus should be after 70. Instead of invasive screening tests, focus on maintaining overall health, eating a diet rich in fiber, fruits, and vegetables, staying physically active to support digestive and overall health, maintaining healthy weight, avoiding smoking and excessive alcohol, and staying alert to your body's signals. These lifestyle factors have been proven in countless studies to reduce cancer risk more effectively than many screening tests, and they come with zero risks and tremendous additional benefits. Here's the bigger picture that gets lost in our test-focused healthcare system. Quality of life becomes increasingly important as we age. A test that might extend life by a few months but causes serious complications that affect your independence, comfort, and dignity may not be worth it. That's a deeply personal decision only you can make. Recent research in geriatric medicine emphasizes what's called person-centered care. This means considering your values, your quality of life goals, your functional status, and your preferences when making medical decisions, not just following standard protocols designed for younger populations. One final important point. If you do decide to proceed with a colonoscopy or other invasive test after 70, make sure your doctor takes extra precautions. Ensure you're adequately hydrated before bowel prep begins, have someone monitor you during prep to watch for dizziness or confusion, arrange transportation home and care for at least 24 hours after, discuss anesthesia options and potential alternatives, and make sure your doctor knows all your medications and health conditions. And remember, medical guidelines are exactly that, guidelines, not absolute rules. They're based on population-level data and may not apply perfectly to every individual. What matters most is making informed decisions that align with your values and circumstances. Before we close, my medical disclaimer again. This information is educational and does not replace professional medical advice. Never decline recommended medical care based solely on internet information. Always discuss your specific situation with your healthcare provider. And if you ever experience concerning symptoms, seek medical attention regardless of your screening history. If this video helped you think more critically about medical testing, please subscribe to Golden Years Secrets. We share evidence-based health information every Tuesday and Friday at 2 p.m. Drop a comment and tell me, have you had conversations with your doctor about the risks and benefits of tests after 70? What was that experience like? I read and respond to every comment. And don't forget to like this video so more seniors can make informed decisions about their healthcare. Next time, I'll be revealing a simple Japanese exercise technique that supports overall body healing. It's gentle, requires no equipment, and you can do it before bed. You won't want to miss it. Until then, I'm Maggie Wells reminding you that being an informed patient is one of the best ways to protect your health. Stay curious, ask questions, and advocate for yourself. I'll see you next time.